and welcome everyone. Like I said, this one's going to be short and sweet, and I'm just going to kind of cover the highlights of what I would like you to remember for HIV and AIDS, and for what you're going to be given on the test or quiz number 3. So we'll jump right in. There again, did I? I don't think I put a video at the beginning of MedSurg 1 about what concepts are, nursing concepts. But you will find that video next year or next quarter when you go into MedSurg 2. I got a little video posted on that class that explains, how nursing concepts differ from the traditional teaching method. Well, we'll talk about that sometime later, but we're going to just kind of talk about, what the HIV virus is and how it works, just the basics. Don't want you to get too complicated in that. And then basically how we diagnose and treat. And lastly, how we manage the HIV. And I'm going to distinguish for you what the difference between HIV and AIDS is. Remember, you see my angry bug, you might see it on the quiz. This is the same concept of immunity. It's pretty much what we've been covering over the last couple of weeks. So that shouldn't be new. HIV, human immunovirus. We're all familiar with the term HIV. It's a retrovirus. Retroviruses use RNA, and what they do is they basically just hijack a cell, they take over the nucleus, and they replicate their own RNA. As most viruses do, what they do is they attach to a cell, they take over that cell, and they turn that cell into a virus manufacturing plant. Different viruses attack different types of cells, and the HIV virus is specific to T cells, which we studied over the last 2 weeks. It first came about in 1981. I remember when this first came out, and I think they traced it back to an airline steward who had come out of Africa, and he had had several sexual partners before they were able to get a handle on it and find out what was going on. So it began to spread after that. And I don't know if this is correct, but I think the gentleman that had the original case didn't even develop any symptoms. So he was basically just a carrier, which is kind of scary. However, by 2013, we've got 1.2 million cases in the US. We get about 40 million a year, or 40,000 a year in the US. I don't know what the latest statistics are, but curious, you can look it up. It is transmitted by body fluids. It is contact. If you have a patient who's positive HIV in the hospital, they will be contact isolation. Anybody know what other contact isolations we have?
Like
Well,
just in general, or for
yeah.
HIV?
If you've been in, some of you might have been in a hospital and seen contact isolations. Probably the most common one, MRSA. Now that's opposed to airborne isolation for like tuberculosis. It can only be transmitted by body fluids. If somebody coughs on you or anything of that nature, you're not going to contract. Hold on just one second. Bad sinuses. Okay, here we go. You're not, it's only through sharing of body fluids. And I'm going to talk a lot more detail on that here in a minute. As I said, with viruses, they'll target certain types of cells. The HIV targets the T4 cells, which is a certain type of T cell. And this T cell is also called a CD4. So they're the same thing. If you see T4 cells or CD4, it's the same cell. And this is the T cell that passes the information on to the B cells to produce antibodies, all antibodies. So what happens is if you lose your T4 cells, your body does not produce antibodies. And if you don't produce antibodies, any infection that comes along is going to overwhelm your body. And depending on the infection, it can kill you. And we'll talk more about that when we get to AIDS. And of course, what I told you here, well, viruses just turn a cell into a virus factory. Now, when we talk about HIV and AIDS, we're talking about two different situations. HIV is the virus itself, whereas AIDS is just a description of conditions. As HIV infection spreads in the body, it kills off the T cells, your body becomes immunocompromised. You don't have the ability to fight off infections anymore. And those opportunistic infections get into your body and are ultimately what ends up killing you. When those opportunistic infections get into your body, that is when you develop AIDS. So AIDS is more a description of a set of conditions. It's not really a disease in itself. HIV will progress onto AIDS. So you get HIV, and then when your T cell count gets too low, about 200, you can develop an opportunistic infection, in which case you then have AIDS. So I just want to kind of make that clear. I think I got an angry bug for that one. Yeah, I do. Not all HIV patients will necessarily progress on to AIDS. Like I was saying, I think the original flight attendant who was originally responsible for spreading AIDS, I don't know if he ever developed into AIDS. And I could be mistaken. I mean, I may have my information wrong, but there are those individuals who will have the virus in their body. For whatever reason, they don't progress into full-blown AIDS. And hopefully people who are staying on their retroviral treatments will not progress onto AIDS either. But as its other bullet point says here, if it's unchecked, it will progress onto AIDS. There are several subtypes of HIV. The most common are HIV-1 and HIV-2. Even within those, HIV-1, there are subcategories like HIV-1 type M, HIV-1 type N. So there's a variety of different types, like all viruses, like coronavirus, viruses mutate. But the predominant one here in the United States and throughout most of, I think, Europe as well, the most common is HIV-1. Now, there is a second type that has emerged from sub-Saharan Africa, HIV-2, which I think is transmissible, has a shorter, I believe it has a shorter latent period, so you develop the AIDS quicker. But that one's pretty much prevalent only in sub-Saharan Africa. So the predominant one you will deal with here in the United States will be HIV-1. Angry bug. I got some of my information from a different source. They had 4 stages. In the textbook, it has 3 stages. Yeah, I'm not going to ask you about that. So don't worry about it if you read material that says there's 4 stages of it or 3 stages of it. But basically, I think the 3 stages is probably a better summary. I might change this slide to 3 stages. But in the first stage, you're exposed to the virus. And when you're first exposed to the virus, you're going to get flu-like symptoms. You've got a foreign pathogen in your body, a virus. Your body's going to launch an immune response. And anytime your body launches an immune response, you get flu-like symptoms. Sore throat, swollen lymph nodes, in your neck, headaches, fever, fatigue. And then it may go away. The person may even believe they had a flu bug, but actually that is the first stages of the HIV infection. Now your body manages to tackle it and get rid of, it believes that you've gotten rid of the pathogen, when really you haven't. And there may be anywhere from a couple of years to up to 10 years where you have no symptoms. But in this time, the virus is slowly infecting T cell after T cell after T cell. Now, your normal T cell count will be anywhere from 500 to 1500 cells per microliter. You also see that in the books as MM3, millimoles cubed. But I believe the number is still the same. Because basically the key number here on this, and the key number to remember, is once your CD4 or your T4 cells get below 200, is when your body is no longer able to fight off infections. So once you reach, as the textbook says, stage 3, on this slide I have stage 4, but once you reach that final stage and your T cells drop below 200, that's when you begin developing the opportunistic infections. And here's you want to remember that number 200. Here's a chart that kind of shows how that works. This is, in this slide, it's showing, okay, here's your normal number of T helper cells right here. And you get initial infection, it drops, you get the flu, the sore throat, the fever, all that type of stuff. But then you kind of recover from it. And this is the period where you have enough T cells to live a healthy life, but little by little, it's weaning them down and it's dropping until you get to about 200. And then once you get to 200 right here, this number here, then your body cannot fight it off anymore. And you drop into what we call the crisis stage here, or stage 3 in the textbook. And that stage 3 is where you're developing full-blown AIDS. Anybody have any questions so far? I'll talk a little bit more about how the viral treatment works, and that'll give you a little more clarity on how the virus itself actually works. No questions? Question period is just an opportunity for me to drink some of my coffee. The number one way that it's transmitted is unprotected sexual transmission. But another method is from mother to child. If the mother is HIV positive, she can pass it on to the baby. Other methods are IV drug use. When I was still in nursing school, I worked in a respiratory unit. We used to humorously call it the spit pit. But the respiratory, we took care of everybody with respiratory infections. And of course, one of the predominant ways that HIV attacks an individual is pneumonia, which we'll talk more about here in a second. But I did have one young man, handsome, just out of high school, whole world ahead of him. Very affluent family. They were going to pay for his college and everything. And he went to a party and tried a drug one time and used a contaminated needle. And he was 18 years old in the respiratory unit, dying of pneumonia. And that was a very difficult thing to see. He made one single mistake, one single mistake, and it basically killed him. So this is a very, very serious disease situation. Of course, this is back in 1995. We didn't have the retroviral drugs, were just kind of getting started at that point. Today, he might have survived, but in 1995, he did not. Accidental needle sticks, predominant field. The number one group that contracts HIV through accidental needle sticks is nursing. Very careful with those sharps. I think in the book it said something like a total of 12,000 nurses had been accidentally stuck with HIV needles. And so it's a serious thing here. And not just HIV, but a host of other diseases and stuff you can get. Be careful with those sharps. Blood transfusions used to be a problem. When it first came out, when AIDS first hit the United States, there were quite a few blood transfusions that spread HIV. We have since developed the filtering techniques better, but it's not perfect. The odds, basically, if somebody ever asks you about that, the odds are 1 in 2 million of contracting HIV from a blood transfusion. We can't tell them absolutely no, you have absolutely no chance of getting HIV from a blood transfusion, but the odds are about 2 million to 1. So it's very, very unlikely that you will, your odds are probably better playing the lottery. Angry bug. Now, this is something you want to remember. There are only 4 body fluids that you can contract HIV through. Blood, in the case of accidental needle sticks or drug users sharing needles. Semen, of course, through sexual intercourse, any form of sexual intercourse. Well, not oral sex, but in the case of vaginal or anal, it can spread that way. Vaginal secretions, so the female can spread it to a male in that fashion, and breast milk, which in case is the HIV positive mother spreading it to the baby. This is really a sad situation, as in epidemic areas in Africa, we have a lot of babies contracting, being born with HIV, which is really sad. You cannot get it from urine, stool, vomit, or sweat. Now, most people today are educated enough that if they know somebody is HIV positive, they don't, treat them like they've got the plague. But when it first came out back in the 80s, it was like if you had HIV, they almost wanted you to walk down the street and ring a bell and claim unclean, because everybody was afraid of contracting it just from like touching the same napkin that an AIDS person touched in the restaurant. But I think we've done good in educating people now to realize that you can still touch an AIDS, a person who is positive HIV, you can touch them and shake their hand and stuff like that. And there's no risk of you contracting HIV. The safest method for somebody who is sexually active is a condom, especially condoms with spermicide, is the safest way for somebody who is sexually active to keep them from getting HIV. You'll have people ask you those questions because people may have a partner who's HIV positive and they still want to have a relationship. So it's good to know what to tell them in cases like that. Testing. There are 2 kinds of testing for HIV. One is a screening test and the other is a confirmation test. Now, confirmation tests are rather expensive and exhaustive. So we're not going to give a confirmation test to everybody who walks in and says, I had sex with a partner I'm not sure about. So we'll usually give them a screening test. The most common screening test is the ELISA, enzyme limited immunosorbent assay. Now you know why we only use the abbreviation for it. But ELISA, and it's also, I think they also call it EIA, there's another abbreviation for it, but this is the most common test we use. The way we go about using that test is because screening tests can have so many false positives, we will give them the ELISA test twice. If it comes back positive twice, then we move on to a confirmation test, which, like I said, is more expensive and more exhaustive, but that will usually nail it down. And the confirmation test most commonly used is the Western blot test. You'll have people ask you about that. I mean, there are oral tests out there you can buy in the drugstore, where you swab it, and I think you send it off to a lab and it tells you positive or negative. But you need to let these people know, I mean, if they buy the oral swab in the store and it comes back positive, it does not necessarily mean they're HIV positive. You have to do at least 2 screening tests first, and those 2 screening tests then warrant us doing a confirmation test on them, which will then give us about a 99% positive result Nothing is perfect. I'm sure they probably had a false positive on Western blot too, but I don't know what the statistics are on that. Has anybody ever watched the movie Philadelphia with Tom Hanks and Denzel Washington? Fairly old movie, 1993. At my age, that doesn't sound like an old movie, but depending on how young you are, that may sound like an old movie. Excellent movie. It's about a lawyer who contracts AIDS in the 90s and all the ostracism that he had to face being AIDS positive. Excellent movie. Should be required viewing. So let's move on to AIDS. Are there any questions on HIV before we jump into AIDS? Like I said, I'll give a little better picture of how the HIV virus works when we talk about retroviral treatments. Once the T cells get too low, 200, to protect the body, then different infections will pop up. And in your book, table 35-2 gives you a list of all the different opportunistic infections that are out there that can affect a person who's HIV positive. Some are more common than others, but basically any infection can get into your body and cause problems. I mean, God forbid that a coronavirus should get in your system when your T cells are 200, because I believe that would be a fatal combination right there. One of the more common infections is called Kaposi's sarcoma. It's actually a cancer. It causes little lesions in the skin. And if you remember back to the 90s, that was the most common sign that someone had AIDS, was they would develop these little lesions in their body. There again, if you watch the movie Philadelphia, it shows that when Tom Hanks starts developing those in his later stages of his HIV infection. That in itself won't kill you, but they are annoying. They could appear anywhere. CMV, a herpes virus, is also a very common infection. For females, the yeast infection and vaginal warts are very common. Where that is good to know in the sense that if a female comes in and developing vaginal warts or repeated yeast infections, it might be a good idea to have her tested for HIV. Because in the normal body, you shouldn't have frequent bouts with that. Your normal body's fauna should be able to fight that off. So, I mean, that could be a clue that maybe she needs to be tested. Probably the most common infection that is the most fatal is pneumonia. And I can't remember what PCP stands for. I think it's Pseudomonas caarnii, and I can't remember the rest of it. It's in the big book if you want to look it up. But it's a case of pneumonia, commonly called PCP. And this is really what usually does an individual in. Their T cells are so low that they can't fight the infection off anymore. And you end up in respiratory distress and respiratory failure. Your lungs just basically fill up with fluid. Another side effect that comes from the infection or AIDS infections is called AIDS dementia complex, or ADC. ADC is more neurological from the infections in the brain. Leads to forgetfulness, decreased concentration, delusional thinking, staggering gait. And that's, we had a situation in the 90s where people with severe AIDS were always being picked up by the police thinking that they were drunk or they were drug addicts or whatever, when it really wasn't either of those. It was the ADC that was causing them to just delusional thinking and staggering gait were the dominant characteristics. So somebody in the later stages of age, you may see some of these characteristics. Just bear in mind it's due to the dementia complex. Here is that table that I just mentioned. I didn't realize I'd put it in here, but as you can see at the top, your cell count's above 500, you're asymptomatic, life is good. And then as it begins to drop, you may get some, like PID, you may get some infections here. And then, I'm sorry. But as you get below 200, here's a whole list of things that can come in there and get a hold of you. And we're not going to go through all of them. Don't worry about it. Medical treatment. You may have seen this advertised. I've seen this advertised on billboards at like bus stops and such in Seattle. The PREP test. It's a let me try that again. Prophylactic treatment. If somebody is being sexually active and they want to protect themselves, or maybe if they have a partner who they think or they know is HIV positive, this treatment helps prevent you from contracting the HIV virus. For those who have already tested positive, the key thing to remember is the sooner we can get them started on their antiviral treatment, the better outcomes they will probably have down the road. I know when probably have not had, no, you won't have it until next quarter, but when we talk about kidney replacement, anytime you have a transplant of any kind, you have to take immunosuppressant drugs because you have to keep your body from attacking itself. If you miss even just one, the pills that you take every morning, if you just miss one, I can't think of the word right now, but anyway, if you don't take your pills just one morning, that can actually cause your body to reject your kidney, and it can totally undo everything that you were working for. Well, the same is true on this antiretroviral treatments. I mean, if you start missing your medications, it can undo everything you're working for, and you can end up developing full-blown AIDS. So it's very, very important that these people start early and that they stay on the regimen and they don't miss treatments. There are a variety of antiretroviral treatments. HIV is a retrovirus. So when we're saying ART, antiretroviral therapy, it's a therapy targeted toward retroviruses, as opposed to, say, a coronavirus or some other type of virus.
Hey, Bryce, I have a question for you.
Sure.
Are people with HIV able to get like the COVID vaccine or like flu shots, things like that? Or did their bodies react differently because they don't have, I don't know, or is it just, are their T cells just affected for that virus? So their immune system isn't down enough to counteract with like a flu shot or a COVID vaccine? That
is a good question, and I don't know, but I'm going to look it up. The COVID vaccine is a messenger RNA type vaccine. It uses messenger RNA, whereas this treatment for AIDS is a retroviral treatment. So they're two different types of treatment.
Right.
But
I just how affected their T cells are
Yeah, I really have no idea what the precautions are for people who are HIV positive and the coronavirus.
Okay.
But that is a really good question. I mean, now you got me curious. So I'm going to look it up and I'll probably post an announcement as to what I found. If I can find an article, I'll post the article in there.
Okay.
But that's a really good question because I have no clue. I mean, they might be able to take the shots no problem, or there might be contraindications. I don't know. The only contraindications I'm hearing right now, I think, are what is it? Pregnancy. And there was one other thing that, oh, they're just saying, you know, don't take any Tylenol, don't take any NSAIDs before or after your first or before or after your shots. And then I haven't really looked into why that is, but they're just cautioning us about taking aspirin or Tylenol after you get your coronavirus shot. So, but I'll look that up. I'll get back to you on that. They have found there are some diseases where we give people cocktails because, okay, there's different ways of attacking the problem. So, and HIV is one of those. Well, they have found that a combination of different treatments really works the best, and because it hits the virus in different ways. And as you can see down here, antiretroviral treatment, normally called ART, but when they put those drugs together into a cocktail, we call that highly active ART, or highly active antiretroviral therapy, or they might abbreviate it. They may call it HAART, but if you ever hear that term thrown around, oh, he's on a HAART treatment for HIV, it just means it's a cocktail of several drugs. And usually it's two of the NRTIs and one NNRTI. And I'm going to explain to you what those are. The HIV virus uses something in its cell that's called a reverse transcriptionase. It's an enzyme. And when basically the HIV virus hooks up to a T cell, it injects this reverse transcriptionase into the cell, the T cell. And the reverse transcriptionase enzyme is responsible for merging the RNA of the virus into the RNA of the T cell. Now, in order to do that, it has to make a duplicate of itself once it's in the T cell. So what the NRTI does is it acts like a reverse transcriptionase enzyme to block the virus's actual reverse transcriptionase from working. We have a couple drugs out there that are like that. There are blockers. I'm especially thinking of like pain medications. Or a good one is serotonin uptake inhibitors. Prozac. With Prozac, you have your serotonin connecting to the nerve cell. Well, and then once it connects to the nerve cell, it goes back and it gets dissolved. The serotonin uptake inhibitors, once it produces this serotonin, the Prozac or the serotonin inhibitors get in there and they block the reuptake part of the serotonin, so the serotonin hangs out longer on the nerve endings. So it mimics the serotonin and it blocks the real serotonin from dissolving. And this is kind of how this works, is if you have a fake reverse transcriptionase in there, then the real reverse transcriptionase can't get in there and do its job. It's just kind of like a blocker. The NNRTI works a little differently in that it weakens that enzyme so that it doesn't work as well. So there's two different ways of hitting that reverse transcriptionase enzyme. One, they block it, and then the NNRTI, what they do is they're actually weakening the enzyme itself so that it hopefully doesn't do its job the way it's supposed to. And these work pretty well because we have people living into their later years now who are positive AIDS patients. It is a lifelong management. I mean, once you're on it for life. You know, you don't get better. We don't cure HIV. It's in your body. It's there for life. Therefore, the best way to prevent somebody from having to deal with it is just prevention. Don't get it in the first place. Practice safe sex. Stay away from dirty needles. Best to just stay away from needles completely, if you ask me. Be sure if the person is HIV positive that they have to notify the doctor if they get pregnant. I think there are precautions we can take for the baby if the mother is HIV positive. Also monitor the patients for reactions to medications. These antiretroviral medications are strong and you will get side effects from them. So you got to be very careful and monitor the patients and how they're reacting to the antiretroviral drugs. Mental health, HIV has a stigma. They're going to face discrimination, isolation, depression, especially as the symptoms start getting worse and worse. And that's kind of where the Kaposi sarcoma is kind of sad, because back in the 90s, when those lesions started showing up on your face, you can't hide it anymore. I mean, you can't, tell people, oh no, I'm okay, because it's like the plague. They're showing up on your face, and that's really sad. Hopefully with the retroviral treatments now, that's not the case as much anymore. And with enough education, people are not discriminating against AIDS individuals as much as they used to. Anybody had any experience with that out there? Heard of a relative or something that have problems with that, or I don't know? Nobody. It doesn't seem to be as big an issue today because of the antiretroviral drugs that we have in place and how well we're managing it. AIDS is not as much in our face today as it was in the 80s and the 90s. But in the 80s and 90s, it was just as big an issue in our society as COVID is today. I mean, it was an epidemic, and it was scary. Fortunately, we knew how to, prevent its spread. So can't do that with COVID much. We're trying. It used to be a death sentence. Usually after you got to the final stage of age, you lasted maybe half a year to a year and a half and you were gone. But thanks to the antiretroviral treatments nowadays and supplemental treatments, also the use of steroids to help the individuals to keep their appetite up, prevent muscle wasting. And there's some other drugs that we use in conjunction with the antiretroviral treatments to just kind of help make their life better. And they can live a full life now. So that's the good news. I believe that's all I've got for you. That's all I got. Anybody got any questions? This was, like I said, this one was short and sweet. Well, okay, not too short. It's 9:45.
Mary had a question in the chat about shadow health.
Okay. Let me stop the recording first, and that will be the end of the session.